Oh yeah, that looks better.
Hello.
Hello. How are you?
I can't complain, honey. It won't get me anywhere. How are you?
Good, good. Let's see if give it a second for some people to jump
Or
on, see what
are you that
happens.
person? Like we're gonna wait until people come on. So
I'm not.
let me
I'm
take a
not gonna
sip.
wait that long. I'm not gonna wait that long, but
I thought I was
um,
gonna be able to go without my glasses, but God said no because I couldn't see.
hopefully I don't look too. Is everything okay? I'm about to move you back. Let's sit down. Oh, okay. Let's see. Frankie's gotta adjust my camera. I still look so close.
No, you. That's better. Yeah, but
Oh,
you're not centered though.
huh.
There you go.
Yeah.
Nope. 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 Nope.
That is so
Tasha
interesting. I'm
said
gonna.
Tasha said she's here. She's all we need. We only need one viewer.
Oh, she is. We don't need anybody else. Sasha has made the scene. We are good.
But
Go.
you're still off to the side. There we go. There we go. Frankie, come on, little inch. There we go.
Behind.
Good. Does it look good?
Yeah.
Right there.
Yep. You're
Okay.
center. Ooh, I can't see today. Lord, this eyesight. I need to eat some more carrots.
All right, we're gonna start. At least, do you have your tablet with the Facebook and all that? Okay, thanks. All right, so we're gonna start with the introduction and get this going. So my name's Tia. I'm a nurse practitioner, and I got Miss Deshanta on live today. I'm gonna let you go ahead and introduce yourself.
So my name is Deshanta McDonald. I'm also a family nurse practitioner, board certified. Dee is easier. Family and friends call me Dee. So I actually work. Well, she's per diem, but I learned to know who Tia is by working with her. She was one of the providers at ProMedica Urgent Care, and she left me. Um, so I'm still at the ProMedica Urgent Care full time, and then I have my own business, Undeniable Aesthetics, Wellness and Aesthetics, which is a concierge Botox filler, weight loss, lipolysis, teeth whitening, among other things that I do on the side. But we are here to talk about some other things today.
Okay. Sorry, I'm trying.
What you over
I'm
there
trying to
fiddling
see you
with?
in the camera. All right, so let's just talk about a little bit of your background and why did you decide to be a nurse practitioner?
Ooh, I don't know how much time we have. So, I actually, you know what? And I'm gonna just be honest. My plan as a child was not to go into healthcare. I wanted to be a lawyer. That was always my goal, but my rearage did not get me into that direction. I did not have the support. I'll say that. I'll just be honest about that. It wasn't until I became an adult in my mid 20s, where my husband that I'm with now, we were currently dating at the time, and he actually thought that I had the personality to be in healthcare. And I went guns ho blazing. So I started off as an LPN and I loved it. I loved what I can do for patients and what I can give to them as far as me, my personality, and taking care of them the best way that I knew how, what I had to offer. And then from there, it's like a natural progression. You become, whether you're STNA or, you're LPN, it's your next step is to become an RN, especially in the healthcare system. I didn't see a lot of RNs that looked like me, to be honest. And I worked under an RN at the time and, multiple RNs depending on the shift. And, depending on the role in certain situations, the LPN role, you do a lot in the hospital setting at the time. I don't know if they have LPNs now, but I'm doing a lot of the same things that the registered nurses are doing, and I want to evolve in that role. So I went for my RN and then BSN. And it wasn't until I started doing travel nursing in the emergency room to where I was looking at nurse practitioners, and I'm like, I was trying to get into what their role entailed and what their job description was and what all they had to do, and I did not see anybody that looked like me. I did not, and I wanted to change that. So I'm like, I know I can do it, and I'm the type of person, if I put my mind to do it, I'm going to succeed at it. I'm gonna make sure I succeed at it. I'll say that. And I went for it. While I was doing travel nursing, I went to school for my nurse practitioner. And here I am, baby, and I ain't going nowhere.
What school did you go to?
So for my NP, I went to Walden online. For my BSN, I went to Spring Arbor in Michigan, and then Owens Community College for the bridge program for LPN to RN. And then I went to PSI for my LPN.
Okay. And then why did you choose family nurse practitioner?
So that was not my first option. So I wanted to go to school to be a CRNA, and I'm gonna just be honest about that too. I was not brave enough. I was conditioned to think that day shift was the best thing. I didn't want to leave day shift. I knew it was hard to get on day shift in certain departments, and I knew I would have to go to night shift to go to an ICU department to meet the criteria to be a CRNA, and I was just too scared to make that move, to make that change, I'll say. So I never went to
Mhm.
nights, and I just stayed in the emergency room, and I said, well, if I'm not going to be a CRNA, what's the next best thing? In my mind, I'm thinking, let me do acute care, because I had that RN mentality, that ER mentality. So I said, let me do acute care. And I said, no, then I would limit myself, because with acute care, you don't see 18 and under, and you don't see obstetrics. So I said, you know what? I'm already a black woman, to be honest. I'm already an African American woman. If I limit myself, then that creates an issue for me later. So I changed my degree to be family nurse practitioner. So it'd be more broader and I have more opportunities.
Yeah, and I know you're talking a lot about people that look like you. When you're saying like there's not a lot that look like me, what do you mean? Let's break that down. What are you talking about when you're saying that?
There's not a lot of black women,
Okay.
black men. And
Yes.
as a nurse practitioner, it's just not.
Yeah.
And the look that I get when I walk into a patient's room, half of them can't even talk because they are in awe. And this is no exaggeration. I just had it last week with a couple of my patients, that they were so excited to see someone that looks like them, someone that can relate to them, someone that they can just word vomit and open up to about all the things that they've been having going on, that they feel that they've been ignored by their own provider. And not to say that they've actually been ignored, but how relatable can you be to someone that you don't know what they can or cannot go through? And the sad thing is there's only like 12.1% of black providers, nurse practitioners in the US. That's a lot. That's a lot. That's a low number. It's sad. And
Mhm.
I don't know if it's based on opportunity, based on perception of the role. A lot of these roles in nursing, and it's just being honest, they go for the money. How much can I get? The compassion is not there. It's not patient based. It's finance, and I get it. I get it. We're different. We're living in a different time,
Yeah.
but we need black nurse practitioners, and even in the urgent care. I mean, you already know. I'm the only full time black nurse practitioner there now. I'm the only one. The only one.
You was the only woman for how long? For how many years?
I was the
There wasn't
only
like
I was the only one and the only woman. I believe I was the first black nurse practitioner hired through ProMedica Urgent Care. And then we had an African American PA. And then, we started kind of the influx. Well, not many, just you and Erica. So there's not many of us that represent. And I really, it's really disheartening, to be honest, because it pulls a lot of you out of you mentally, physically, spiritually. It's like you want to help everybody and you can't. And it's like, what do you do with the best that you can do given the situation? So, a lot of patients ask me, do I have a practice outside of the urgent care, because they want me to be their provider? And I don't, but I understand that. You want someone who's relatable. You want someone that
right.
understands what you go through. And it's sad that the percentage is so low. 12.1% is crazy when I looked it up.
Latasha said that she finally found a provider. Her first appointment's tomorrow.
Oh, tomorrow?
But
Yay! I'm so happy for her. Yes, yes, yes.
what? Tell us who it is. Shout them out.
Oh,
Just
she said
curious.
she's in.
Yeah.
I think she's in Columbus though.
Oh, is she? Okay.
Yeah, she's in Columbus.
Wisconsin? Oh, okay.
Yeah,
Oh,
so
well,
she's not
darn it.
here. But
Okay.
I mean, we have Black providers in different specialties that I do know, but not in family practice.
Yeah. 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 Practice is, I like you said, I don't know if it's an opportunity. I feel like there's more in psych.
It is.
Yeah. Yeah. There
Yep.
seems to be more
Or
in
C, and
psych.
I've met CRNAs also,
Yeah.
several CRNAs and psych, but not a lot in family.
Hmm. Yeah, which I think is interesting. Do you feel like the diversity since you started as, your NP career, do you feel like it's changed any, or is it
Yeah,
still pretty much?
I don't believe
You
it's.
know,
I'm not gonna lie and say that it has because it hasn't.
okay.
Yeah, it hasn't.
Okay.
And
So,
and ancillary staff, yes. As far as medical
okay.
assistants, nursing assistants, front desk help, but as a provider, no.
Okay. Do you think, I guess, why do you think that reason is?
I don't know if it's like I said, everything's let's be real. The economy is changing. Is it financially based? Is it like you're not meeting requirements as far as what I want or what I'm asking? Is it based on availability? I don't know. It's hard to say. I was blessed to be able to have this job because I knew the person that I precepted with because I worked with her in the ER. So that was an open door for me to have this job. But would I have had it otherwise? I don't know. It's hard to say.
And what about in your business? Like, because you own a
I,
business.
I
What
do.
kind of business do you own? An aesthetic
So
business.
I
So how do you feel with that, like being a Black nurse practitioner with aesthetics and in that field? Because that's a whole different ball game than urgent care.
It is, and initially, I'm just going to be honest. I have a lot of white patients. And a lot of them are people that I used to work with that feel comfortable with me, and I appreciate that. And trust me, support small business. I love everybody who does. I had a bigger issue with my African American patients that the mistrust, because when you hear Botox, you hear botulinum toxin, like, oh my God, they're trying to poison me. The Tuskegee syphilis, that syphilis study, it kind of damaged people mentally, and that happened years ago, but it still reigns today. So African American people, even with the COVID vaccine, if it's injection based and they are unfamiliar, it's disregarded, or it's basically looked at like, why are you doing it? Why are you killing yourself? Why are you doing this to yourself outside of the positives? It's more cons.
Right. And I was like going into my next question. You kind of started answering it. Like, what specific challenges have you seen with, being a Black provider and taking care of, I guess, any type of race of patients? Like, do you feel like it's more challenging? Do you feel like
Oh
you
yeah.
can relate more?
So
Or
you know
how do
what?
you feel?
It's a seesaw. I get both sides. It was actually worse when I was a registered nurse, I will say, especially working in the emergency room. It was as simple as me opening the door, introducing myself, badge, biggest day, saying RN, and they would tell me they wanted a white nurse. And I would ask why, because that was interesting to me to be so blunt and entitled, to be honest. And they would basically say, because they know more than you, which is
Oh,
funny to
wow.
me. Because why is that the perception the minute you see my skin color? Like I'm not knowledgeable, but that's what some think of us, that we aren't smart enough. And just because of who I am and my personality, first of all, I'm not going to go get a counterpart to take on something that I know I can. I would simply walk out of the room, misleading them, more than likely. That's fine. And I will walk right back in with the same authority that I walked in the first time and introduce myself, my job title, and ask them, if you need to be seen today, how can I help you? Because I'm not going to get anybody else. I can do the same thing they can do, depending on who it is. Not to be funny, honey, if not better. Because I'm going to give you the best care possible. I don't care about your race. And a lot of people, they are more focused on that and the capability of what you can do for them. So as a provider, it's more subtle. And I get it from a lot of older patients asking me my education, where I go to school, how long did I go to school, and they act as if though I have a cape and I'm the Black superhero of all African Americans, basically saying, the community must be proud, as if none of us are educated or none of us have went back to school. I'm not the only one you may have come in contact with, but there are several African American, well educated people in different areas. I'm not the only one. So, even when I open a door, the look of, oh, and then I'm like, oh, what, is there something wrong? Oh, I thought I was getting someone else. Why would you think that? Because, in our setting, you can see the
Right.
providers that are there. And yes,
Hmm.
I work with, Arabic, white, black. Yeah. Doesn't mean you're going to get a white provider when you come here. You get who basically is there working on the shift. And
Hmm.
there's a rotation, no matter what skin color, we're going to give you the best care possible. But I noticed that when I walk in a room, there's a shift like, oh, like, okay, this is what we're doing. This is what we're doing. Yeah.
Do you feel like it's mostly negative or positive or in between?
I get in between. I get it from both
Mhm.
sides. I get African American patients who look at me like, who does she think she is? And there is a guard up, and I have to break it down. I'm comedic, in my care. I try to, I crack jokes.
Mhm.
I try to be relatable. Whether it's if you got an Ohio State shirt on and I'm a Michigan fan, we do the banter back and forth just to kind of break some walls down. But I get it. I feel it. You can feel it. It's obvious. Like I said, some African Americans are elated when I walk in and their face lights up like they're a kid in a candy store. And there are some that are more reserved and more agitated and, very short with me no matter what I do. And it's like, okay, I just proceed with I just do the best thing that I can in the environment that I'm given. That's what I was taught.
Yeah.
So it doesn't phase me. I see it though. I mean, it's sad, but I see it.
Do you feel like that's with other races too? You kind of get the same, like in between with other races of patients that you take care of?
Do I get the same in between if it was a white counterpart versus me?
Yes, like a reaction. Do you feel
Yeah,
that shift that you
yeah.
described? Do you feel
Yes.
that too is
Oh,
about the
yes.
same?
Yes.
Okay.
Yes.
Okay.
Yeah. And
Okay.
then some of them, it depends on the visit. So some of them will see how I am throughout the visit, if I'm relatable, if I gave the best care. And then after the visit is when I get the accolades like, oh my God, you were so great. But you would never have seen that during the whole visit because of the distance and the walls that's being up. Like I said, I do the best that I can no matter what race. It's sad that we're still in this era where we're not good enough, no matter if you're wearing a white coat or not. And like I said, I've been through so many trials and tribulations in my life. I don't let it phase me, because I would be a whole different person if I did. Like I said, I get the best care possible. Everybody is not receptive to me, and I know that because I can be very direct. And
Hmm.
I'm big on educating my patients, whether they want to hear it or not. And depending on the environment or what they're there for, they may not want to hear it because some patients want what they want. But I'm very big on education, and I want patients to get the best care that they can get, depending on the visit. And it's just projected and seen differently sometimes.
Yeah. Yeah. I mean, I definitely think you're right about that. You are direct, but I like it. I like just knowing what I'm walking into. I just want to know. I don't want to any gray areas or anything like that. So I love it. But like you said, not everybody wants that, or not
Mm-mm.
everybody's ready for
Mm-hmm.
that. Those answers like that.
They're not.
As far as like in your career, have you had like a mentor that's really African American mentor? Let's go there first.
Um,
That's really like influenced you with this?
so I had one. She was actually the educator when I was at LP. Her name was Rose Cross. She used to always tell me when I was going back for my RN, and used to be like, D, she was, I don't want to get her nationality wrong. I don't know if she was Nigeria. I don't know what her nationality was, but her accent, I always try to
I know,
mimic her
bro.
accent. Rose? Yes,
Yeah.
I love her. So she
Yeah.
was a big influence for me. But a lot of people that poured into me was not African American. A lot of people that gave me a chance or saw something in me was white. Like they understood and it's hard. Like this nursing career wasn't easy for me because I was a roadblock for myself sometimes. Rose was Jamaican. Okay, Tasha, because I'm like, what was she? Um, but I was a roadblock for myself sometimes because I let my attitude get in the way. And sometimes that's the expectation for us. We have an attitude, we have a chip on our shoulder. And you know what? I did have a chip on my shoulder because, with nursing, they tell you to leave everything at home, no matter what you got going on at home. When you get to work, honey, it's a clean slate and no one's supposed to know what you're going through. but I was young and dumb. And the things that were going on from my childhood on that I did not release, I projected into how I felt. So if I
Mm-hmm.
felt that things were wrong, I was more vocal than what I should have been. And my approach was not the best. So my delivery was off a lot. And sometimes I had to understand that it was a default of mine from me advancing in this role. So there were people that were not African American that were told, don't give Dee Dee a chance. And they wholeheartedly did. And I skyrocketed after that. So I am very grateful for Jean Davila, and I'm very grateful for Annie Miller, because when I was an LPN, Annie pulled me to the side on several occasions and was like, she will always tell me, and I just did not see it. She's like, you're going to be bigger than this role that you have now. I see something in you that you probably don't see in yourself, and I'm all new, like, meh, meh, meh. I didn't realize what she was saying at the time until I was older. And I was like, so I do that now. So, and it seemed different. Like I pour into our Black women, especially because a lot of people don't. A lot of our Black women have hardships at home. They are dealing with, being a single mother, whether their finances aren't in order and they're trying to, and they're working several jobs, trying to manage school.
Mm-hmm.
I pour into them to let them know they are not their current situation and that there's something bigger and better for them. Some are receptive and some are not, because they were me. I see me. I wasn't receptive. I'm like, who are you to tell me what to do? I'm grown. Like, I know what I'm out here, but I was out here in the wrong form and fashion. I needed somebody to rear me and mold me, and I didn't have that. So I do my best to pour into us, whether you're an LPN. Girl, go back to school. Go back. Make yourself more marketable. Pour into yourself. Give yourself something that you can see later. Don't think that the current situation that you are in is what's binding you from succeeding. You don't have to be there. So a lot of people are still in that, they're conditioned to think that where they're at right now is where they have to stay. And you don't.
Mm-hmm. Yeah, you talk about that chip on your shoulder, and I feel like a lot, when we go through some of these trials and are tested, that's hard. How did you learn to, I guess, brush that off? Like, how did it take time? Did it take
You know
maturity?
what?
How did you
It
learn?
took maturity, and it took the same organization that I'm working for now to tell me that I was going to be an LPN forever, because of
Mm-hmm.
some things that happened. And I was graduating from RN school in 2007, and I'm graduated. About to take the state boards. Like, I know the next step for me. I'm interviewing for different positions, intermediate, ICU, and everyone told me that there was no one hiring. And I'm working in the same hospital setting, and I know that there are needs. But based on my attitude, which I did not see at the time, they told me that I can go to a different hospital, and Toledo Hospital wouldn't hire me, but I can go to Flower or Bay Park and try. But I knew that that was a trap, because if I left this system here, I wouldn't be able to come back. So that's why I said that there was one person who, when we transitioned, they told her, don't give her a job. Kind of let me kind of just sit here out on this island by myself to where I would eventually leave. And she said she wasn't going to do that. She wasn't going to go based on what everybody said about me until she knew me for herself. So
Mm-hmm.
she's the one who gave me a chance to say, you know what, I'm going to keep you here, and you're going to be an RN on my unit, and the rest is history. The same organization that I'm working for now, I started off in the laundry department. I was 19 years old,
Wow.
in the basement, the lowest paying job in the hospital setting. Pennies, getting pennies, slinging everything that came from the floor, poop, everything that came from OB, everything. I didn't see myself at this level. I would go to the cafeteria and see white coats and people looking professional, while I had on all this garment going down in the basement to sling this crap again. I had no idea what God had planned for me, because my focus was different at the time. So maturity plays a big part in how we perceive ourselves and how our future is going to look, to be honest. So it took
Mm-hmm.
time. It took
Yeah,
me realizing who I wanted to
yeah,
be.
that is amazing.
Yeah.
Yeah,
Did I want to be the
it's
same angry
amazing.
person? And that anger kind of deflects on other people, to where that's how they treat you. That's what they know you by. And it kind of pushes people away. And me taking care of patients, I couldn't have a chip on my shoulder because they need me. They already got a chip on their shoulder because of what they're going through. I have to be their reason. I have to be their calm to their storm. So it took a while for me to learn that.
Now, we don't take care, obviously, we don't do primary care in urgent care, but with your patients, do you notice a disparity with the care, like our African American patients that come in, like whether they don't have insurance or they don't have a primary care? Do you notice a difference from that between other races?
I do notice that a lot of them do not have a primary care because they don't think they need one. And I learned with us, especially African Americans, and even our counterparts, if nothing critical has happened, they feel like they can manage whatever they have going on at home. And a lot of times they don't take their blood pressure medications, their, diabetic medications, cholesterol, and they haven't had a stroke yet. They haven't had a heart attack yet. So I'm okay. And when
Right.
I see this blood pressure of 180 over 120, and I'm not, and they're here for, I don't know, ingrown toenail, just an example. I've spent more time in the room talking to them about their blood pressure and how critical that can be to their health as far as kidneys, dialysis, aneurysm, heart attack, blood pressure, stroke. And they're looking at me like, why are you talking to me on this critical level when I'm here for an ingrown toenail? Because I am a family nurse practitioner. At the end of the day, we take care of our patients holistically. I would love to talk to you about your toe and ignore your blood pressure because I'm not your primary care doctor, but I may be the one to save your life. You may make some health changes later if you know what can happen if you don't.
Yeah. Yeah, that is so important too. People come in with ankle pain and their blood pressure is crazy or their heart rate is everywhere, and
Right.
they just like, well, that's not even what I
Yeah.
came in for.
Yeah. I know.
But
And I'm like, but you may not wake up tomorrow because your body's
yeah,
only going to compensate so much. Kidney shutting down, dialysis, it's like a whole life change if you don't make the change now. And sometimes you just have to kind of beat it like a dead horse, so to speak, for them to get it and give it to them a way that they'll be able to understand. I hate to mention death in a visit, but you can die if you do not take care of yourself. It's just simple as that. Stress, silent killer. A lot of people have all these stresses at home. They're dealing with family, they're dealing with work and finances. And then, they don't have a history of blood pressure, but it's high. So I'm asking them, any stressor? Yeah, my life is going crazy. Honey, you got to alleviate some of this stuff and pour some more time into yourself because you could take care of everybody in the world. But when you're gone, then what? You only got one of you. And I preach that all the time. We only have one. We have this one system that God gave us. At the end of the day, you got to take care of it or you won't have it.
crazy. I was just thinking, like, when people come in when they're dizzy and they fell and their ankle hurts with their blood pressure high, they don't realize how all those are connected. Like, your blood pressure being elevated made you dizzy, which made you fall, which made you break your ankle, and now your blood pressure's even higher. it's just,
I
it's
know.
crazy
I know.
the cycle with
But
that.
like you said,
So
they're
I,
like, I'm not here for that. I'm here. But no, this all plays a key role in why you're
yeah,
here. These all are all connected. Yeah, but a lot of people don't understand. You go to a doc, you have a primary care physician so you can get your annual visits, you get your lab work, you any healthcare concerns. We can refer out to different specialties, but certain specialties that urgent care can't refer out to. You need your primary care physician to give you referral, whether it be to pulmonology, to GI, because there may be some simple things you may think that are really simple, but you haven't had the appropriate diagnostic to see that something else is going on in the back end causing these simple problems. So people think they have to have a major issue before they are seen by a primary care provider, and that's just not what you use them for.
yes. And I've heard a lot too is that people are frustrated with who they get assigned to, or they just feel like the provider they went to see wasn't listening to what they
Mhm.
say, so they just kind of gave up. And they don't really like know how to advocate for themselves. How would you suggest someone that needs a primary care and they are just kind of thrown into whoever has the first available appointment? How would you suggest they advocate for themselves to make sure that their needs are heard and their concerns are heard?
So I always tell patients, make sure you have your list of medications. Be very precise of what you take and when you're supposed to take it. If you're transitioning from a doctor or you've had meds that you've taken before, and you have to ask questions. Anything that's happened to you, whether you were dizzy last week, or you have this muscle pain in your back that hasn't went away. Be very precise in your questions and get an answer. A
Yeah.
lot of patients leave their doctor and then, and this is real talk. I get a lot of messages in my in basket about questions that patients have left their doctor or specialty and they're asking me. And I'm
Mhm.
like, did you ask the doctor? No, I don't want to dump this in his or her lap. And I'm just like, I'm not your provider to pull the time into digging into your history and all of that when you're supposed to you're supposed to be precise and be diligent to ask your PCP. A lot of people are scared, I think, to ask certain questions, and maybe they don't want the answer of the reality of what's really going on with them. But they don't ask questions, and then they limit their visits to being rushed. Like if you feel like you're being rushed, be vocal. You have to know their provider may not know. But the thing is, if you don't ask questions, how would I know? There are patients that come into
Mhm.
urgent care and they'll come in urgent care for an issue they've had for 6 months to a year. That's not an urgent care issue. But I'll ask them to get a history. What have you talked to your PCP? Have you talked to your PCP about it? And they're looking at me like, no. And I'm like, why not? I didn't think it was important. But so it confuses me because it's important enough for you to be here and
Right.
drop it in my lap, and I'm gonna do the best that I can to take care of it. But sometimes we just can't. We don't have the resources, and they do. So if you have a PCP, you have to be diligent and be direct with what you need from them. And so, like Latasha just said, she asked her doctor about boric acid suppositories. A lot of OB-GYNs are not well versed in boric acid. And the thing is, do the research. We
Yeah.
were always taught in school, if you don't know, find
Yeah.
out, get an answer. It's just not
Yeah.
cookie cutter. I don't know, good luck. If my patient is asking me for something and I have it in my wheelhouse to be able to do, as long as I do the research, it's educating ourselves. We have to be educated. We're educated every day. We don't know everything. And to act as
Right.
if you do, you don't. But it's okay to not know, but then do the research to find out. I don't understand this whole I don't know. And then you kind of push the patient off. And then here we go again with my questions weren't answered. I don't feel like I got the care that I deserve. And
Mhm.
then I'm left out here on this island by myself to figure this out. That's not fair.
No, it's not fair. You got to hold your primary care
You
accountable.
do.
You
You
have to.
do.
You have to.
You
Because
do.
that's what their schools would be doing. They're your primary care. So that means primary care is whatever you need done. Whether you have a specialist on or you don't have, if you're waiting for a consult to see a specialist,
Yep.
that primary care provider should still be providing care for you.
In the
That
meantime, yes.
Yes,
Yep.
yes. And
Yep.
you got to hold them accountable.
Yep.
And if someone doesn't want to take accountability, you have to find the person that's right for you.
Mm-hmm.
So even it might be switching a couple times to a different
Right.
doctor. I always say research that
Yes.
provider, to research who you're going
Right.
to, get the
Right.
name.
Right.
So many people go to doctors, they don't even know the name of the
They
doctor
don't.
going to. So
They
you've
don't.
never looked up this person. You've never seen what school they went to, how many years experience, or what other patients say about it, or if they've had any lawsuits, or is there so much information? Now we got this Google. People love to Google their symptoms when they come to urgent care. Google that doctor.
Right.
Google that provider. Do your research, even into the providers that you are seeing.
Right.
So you know about them. You come to your appointment. You know about
Prepared.
them. They know all about you. You
Yes.
got all your health history and they gave this person. You don't know anything about this
It's like an
person.
interview. When you go to an interview, you're prepared. You're supposed to
Right.
ask the job questions. You're supposed to have done the research on the job to
Yeah.
see if it's a right fit for you. It's the same thing. This person
Yeah.
is over your overall care. Make sure they are competent. And
Mhm.
if they don't know, say, hey, are you able to do the research? Because I am interested. I'm getting this issue a lot, whether it's BV or any other issue,
Mhm.
because I used to get BV in the past. And I didn't realize it was from my IUD. My provider had no idea. She kept feeding me flagyl, feeding me flagyl. It never went away until I got my IUD out. And
Mhm.
for whatever reason, my body was rejecting the IUD. She didn't know. I didn't know. And then it's like, what can you do to help me instead of pushing these meds on me? She had no
Mhm.
idea.
Yeah. Yes. That is so common. It's
I
so
know.
common. It's so common. So who figured that out? Where did you figure that
Well,
out?
because I had to, I'm not gonna say how the IUD had to come out, but anyway, the IUD had to come out, and after that, I never had an issue with it. Like there was never an issue.
Okay.
So
Okay.
I
So it kind
I put
of
two and
figured
two
it out
together.
after.
Yeah, I'm
Okay.
like, it had to be the IUD. It had to be.
Yeah.
Yeah.
Mhm.
Yep.
Yeah. I actually heard that. I've heard that quite a bit from the IUDs. Like that's just something that can happen. You don't really know until you
Until you
get
get
one
one.
and start having these problems.
Right.
But yeah, so like you said, like boric acid, there's so many other vitamin D. Like people don't realize vitamin D can lead to anxiety, depression, low vitamin D levels. Just taking a supplement, taking vitamins. Like it's there's so many different things that you can educate yourself on and bring to the table and still advocate because you know this information. You know, I'm just like everybody needs to research. That's just what it is
So Latasha
nowadays.
made a
Like
comment, and she's right because I tell women this all the time. Because we do have a lot of women that come in with vaginal discharge or they have a chronic history of BV. I always ask them before I treat them, do they know what causes bacterial vaginosis? And a lot
they don't.
of women do not know.
Mm-mm.
All they say is I don't take baths. But the thing is, you have to know what can change the pH. Like this, it boils down to what changes the pH for the overgrowth of the bacteria. Can a menstrual cycle change the pH? Yes, it can. And we have that monthly. Some women have this after or during their menstrual cycle. Some women don't understand that the biofilm is carried by a man, even though they don't have treatment. They can carry the biofilm on their genitalia, which can transmit it onto you. It can be from you wearing tampons, not letting her breathe during that menstrual cycle, taking baths, perfume products, sperm, condoms. African American women are have the highest percentage of the marker for Gardnerella vaginitis over any other race. So there are things that we have to do as far as taking probiotics, making sure our diet is in order. Are you adequately hydrated? You know, a lot of patients I have tell me they don't drink a lick of water, not
No,
even like girl, no water, no, not
no,
honey, not one drip, not one drip of
no,
water. Mm-mm,
mm-mm,
mm-mm.
no. I
Water.
mean,
I
add
don't
some
get that.
Kryptonite or something. You need some water.
I don't
You
get
know,
it. That's
put some
crazy to me.
put
No,
some
not one
lemon in it.
sip.
Lime. I don't know.
So
So many
your
research papers
body
on it.
talks to you in
Yeah.
different ways.
Hmm. Yeah. Your body is like 75, 80% water. Your organs. If you're not drinking water, your brain doesn't function right. Your nothing
Mm-mm.
function right.
Nothing.
Your uterus, your bladder, everything, everything is out of
People
whack.
don't get
So
that.
yeah, that happens so much. So in the future, what would you like to see in healthcare as far as like the changes in healthcare, changes with patients? What would you like to see? Where would you like to see healthcare go?
I like, of course, I want to see more diversity. Um, and it's hard to say how to do that because it is individualized. It's the person's preference of what they want to go into as far as their career, or if they see a benefit. If people don't see a financial benefit of being a nurse practitioner, why would they do it? You know, I don't do it for that reason because I know I can give back more than that. I would like to see more cultural competence in healthcare as far as training because it actually allows providers to have a better understanding and need of different patient populations because everybody requests something different. You can't treat everybody the same. It's not standard across the board.
Mm-hmm.
You know, and I've always told people that even once a registered nurse, you know, you've got Jehovah Witnesses who don't do blood transfusions. So you have to, when it comes to surgery, what kind of bloodless surgery can you do for them? You know, African Americans, you know, you have some African Americans who are Muslim. You have to give them options as far as dietary. Hispanic and Latinos, you know, everybody is different. So there has to be education on how to. I'm not saying you have to understand, you're not going to understand 100% of what every patient population goes through, but to have a kind of a surface, an umbrella to be able to know how to treat them. The one thing we do have in the urgent care is the language services and interpretation. I love it because I can't recall how many languages it has access to, but they also do sign language on there. So that's a wonderful thing. Population, whether they are non-English speak, have sign. So that's something that I love that we've included. More research has to be done on maternal and fetal death, to be honest.
Yeah,
Yeah,
yeah.
African women, the percentage, I believe, is like 10.0.1% to every 1,000. And then our counterparts are like 4.86%, and theirs have decreased within the last year or two. Ours
Mm-hmm.
have not. Ours steadily incline. And I was doing some research on some things of why. A lot of times we have this mistrust of the healthcare system based on
Mhm.
what we've observed through our family, our mistrust of, if they can appropriately care for me because they're not black. A lot of people want a black provider. And at the time, is that realistic? No, it's not, because there's not a lot of black providers in every department in
Mhm.
abundance for us to have a choice. And sometimes, we have preeclampsia, hypertension, during pregnancy, which causes fetal mortality, and weight restrictions and things of that nature for a child. Gestational diabetes. Sometimes these things go unmanaged. And if the mom is not managed properly, then that causes, difficulties with stillbirths, premature births, um, growth restrictions for a child. So if you're not managing the mother properly, or she's not getting the appropriate prenatal care, then that kind of is, what word am I looking for? So basically the child suffers, unfortunately. So, we when a patient, African American patient, is voicing her concerns during her pregnancy, or whether she's pregnant or not, her voice goes unheard. And
Mhm.
sometimes, some providers may base patients' care on insurance. Unfortunately, I don't do that. I give every patient the right, equal care, whether they have insurance or not. I really don't even know what insurance you have. But sometimes they feel as though they're not being heard. So they may not get the right prenatal care because they may not go back to that provider and feel like they can manage this at home on their own.
Right. Yeah.
It's
That's
it's it's
crazy.
increasing. Those numbers are increasing, and it's
Gotta,
sad.
we gotta advocate for ourselves. We
Yep.
got to do better. Better
We
for
do have to do
sure.
better. Yeah, we do.
So in your role right now, is there anything that you would change or do different? Like if you looked into your past and is like your past, would you tell your past self like to do anything different right now where you're at today?
I appreciate the experience that I did get as an LPN, to be honest, but I think that I would have initially went for my RN first
Mm-hmm.
and
Yeah.
not have done my LPN, because at the time, like I said, my mindset was different. I was thinking how I'm gonna get this money, how I'm gonna get it now, and how much time I felt that I had. And I'm like, I got this year program, I'm gonna run through it and we're gonna get started. And when I got started, I actually made less as an LPN than some of the nursing assistants on the floor. So yeah, it wasn't it wasn't what I thought it was going to be. But
Yeah.
I would just kind of push through school. I would actually start in high school. So a lot of kids now, they have opportunities that we didn't have before. You can get college credits. And at the time, we did. I was kind of neglectful in my high school learning, but if I can go back and talk to my younger self, I would say stay in school, take college courses, because there's a lot of students now that are graduating high school with college credits, if not an associate's in a career, and they can get started straight out of high school into the workforce. But you have, I mean, and you know what? And that's why I tell people, everybody doesn't have to go to college. There is debt accrued when you go to college. I get that, and some people can't afford that. Get you a skill, get you a trade, but be active in your own life. You have to be active in your own life because no one else is going to do it for you. Once you come into adulthood, trust me, the world is not kind. You will not be catered to. You have to produce. And that means
Right.
that you have to give your best in everything that you do and be focused on what your future looks like for you. And yes,
Yeah.
so I do get the bridge program does work for single moms. That's why, and so because I did do the LP and the RN bridge, so that's why I'm saying it at the time I understood why I did it, but when I progressed in my career, I'm like, you know what? That's the only thing that I would do different. So I don't have kids, and it worked for me. And there were mothers in the room who had 3 or 4 kids, and she was making it happen. So it depends on your life situation on how you deal with that. I just feel like now, because of where I progressed in my career, I just would have done it sooner. And that's really only thing I would have changed, because where I've been kind of made me who I am today. So to a certain extent, I wouldn't change it.
Okay. And what advice would you give African American students, kids? I mean, anybody can go back to school to be a nurse, but what advice would you give someone who's considering going into healthcare?
So I've actually mentored and had high school students shadow me. So that is a opportunity for high school students. I had someone ask me in church yesterday if her daughter can shadow me. Of course you can. Because you need, will you get a total feel of what healthcare looks like? Maybe not, but you can kind of get an idea of the patient dynamic and what this role entails to a certain extent. To know if you want to get into healthcare, it may scare some
Yeah.
people. You know, I would look into if you want to be, a doctor, a pediatrician, obstetrics. If you can follow or shadow someone in a specific area that you're interested, that will really give you an idea if that's something that you will be interested in later. And if you have the opportunity to do that in high school, I would do it.
Yeah.
Yep, I
Yeah,
would
I
do it.
agree. The earlier you can start it, the better. So, I mean, like I
Yes,
said, you can go back. It's never too late. So I don't want anybody to feel like if you're 30, 40, 50, that you can't go back to be a nurse, like, or
never.
anything, do anything you
Yes.
want in the healthcare.
Yep, you
Um,
can.
you can at any age,
And it's
obviously. So,
so broad. I tell people, I'm like, nursing is not limited. You can do anything. I mean, just nursing, even, whether you are in different areas of specialty, and then you can get your graduate degree. You can teach midwifery. You can CRNA, family nurse practitioner, acute care, aesthetics. You can do anything. I love that about nursing because it's no limitations. It's so broad.